Hashimoto's thyroiditis and hypothyroidism have generally been viewed in traditional medicine as an uncomplicated and easy therapy. But, we all know that this disease is a lot more complicated and multifaceted. What usually ends up happening when a patient goes to his primary care provider with complaints of symptoms of low thyroid hormones, such as depression, weight gain, insulin resistance, fibromyalgia, chronic fatigue, irritability, dry hair, and constipation, is that the physician will take care of those conditions separately by prescribing plenty of drugs. Traditional medical health practitioners won't, on average, initiate thyroid replacement until TSH ranges reach approximately 5 to 10. Furthermore, various studies have revealed that TSH can be a lack and inconclusive measurement of thyroid function. Hashimoto's is the most often cause of hypothyroidism due to the dysfunction of this gastrointestinal system, resulting in chronic inflammation and destruction of the thyroid gland. Interestingly, there are also many different people whose thyroid blood tests seem normal but experience the same Hashimoto's hypothyroid signs and symptoms. These patients demonstrate what is known as cellular hypothyroidism. In cellular hypothyroidism, even though the pituitary is functioning satisfactorily to convert T4 into active T3, hence exhibiting normal thyroid range, there's a deficiency in adrenal energy required to transform that active T3 into cellular tissues. Moreover, a molecule found in cells is converting T4 into inactive reverse T3. For that reason, standard thyroid blood levels aren't indicative of thyroid function because of low cell thyroid transport. Thyroid hormones are crucial since they modulate metabolism, cardiovascular health, digestion of food, muscular control, brain development, mood, and bone care. Thus, it is critical to have adequate degrees of active T3 in the thyroid and all various systems within your own body to keep optimal homeostasis. Hashimoto's and cellular hypothyroidism are exacerbated by physical and psychological stress, depression, osteoporosis, weight gain, fatigue, fibromyalgia, inflammation, and autoimmune diseases, lupus, Hashimoto's, multiple sclerosis, arthritis, etc. As discussed, the symptomatic effect of Hashimoto's is congruent with the impacts of cellular hypothyroidism, where these patients had decreased amounts of T3 will exhibit fatigue, low disposition, heart disease, muscle weakness, constipation, dry skin, baldness, bad concentration, weight gain, fertility issues, menstrual irregularities. What's naltrexone? Naltrexone is a medication typically created for people who have a problem with alcoholism and opioid drug addiction. When given in higher amounts, naltrexone attaches to opioid receptors to block the pleasurable effects of opioid drugs or alcohol consumption. Individuals who consume alcohol or use opioid drugs while taking naltrexone can get very sick, which further reduces their desire to use these substances. In lesser doses, naltrexone sometimes will help manage autoimmune disorders. Low-dose naltrexone is used as an immunomodulator to aid people who suffer from autoimmune diseases, including Crohn's condition, multiple sclerosis, lupus, psoriasis, and rheumatoid arthritis. Research on low-dose naltrexone has been promising in suppressing cancerous tumors too. Most patients with autoimmune illnesses begin with a very low dose starting at 0.5 mg and will increase to approximately 4 mg as tolerated. These dosages are way lesser than compared to the 50 mg dose prescribed to treat alcohol or drug use. The drug titrates up closely based on your thyroid hormones, TPO antibody levels, and the way you're feeling. Doctors have been prescribing LDN for autoimmune conditions for nearly 40 years. Using naltrexone in autoimmune disorders is known as the off-label use of this medication. There are very few large clinical trials and standardized experiments analyzing this drug and its use in autoimmune diseases. Most studies conducted using LDN for autoimmune conditions are on people with Crohn's disease. Some studies show that LDN can reduce abnormal inflammation and cytokine generation and effectively normalize resistant abnormalities in most autoimmune diseases. Clinical trials looking specifically at low-dose naltrexone and Hashimoto's are virtually non-existent. The likely explanation for that is that the drug companies do not have a lot to benefit from financing this type of research, as LDN is an outdated generic drug plus it's relatively cheap. We have plenty of clinical data on doctors willing to prescribe patients and want to talk about their experiences. How's LDN thought to operate for Hashimoto's patients? LDN has anti-inflammatory properties and increases the endorphin role that will help regulate the immune process. By diminishing inflammatory cytokine concentration, reducing interleukin activity, also lowering inflammatory markers, and it's thought that LDN can improve thyroid functioning effects both at the adrenal gland and at the body's peripheral cells. These mechanics have been shown to help enhance T4 conversion into active T3. Moreover, LDN has been shown to inhibit cells that cause the autoimmune procedure. LDN can reduce autoimmune conditions, including fibromyalgia, Crohn's disease, arthritis, and multiple sclerosis. Using LDN for chronic diseases remains considered highly experimental. The impact of LDN on autoimmune conditions is centered on Crohn's. LDN was found to improve symptoms in 10 Crohn's patients who participated in researches. There is no clinical evidence that LDN may help relieve Hashimoto's or underactive thyroid symptoms, but a few doctors consider LDN a treatment. Side effects of low-dose naltrexone. Luckily, the reported side effects of LDN are mild and rare. Generally, most people endure LDN well. Some known possible side effects of LDN are nausea, headache, vomiting, insomnia, anxiousness, joint pain. Anecdotal evidence from a few people's personal stories found that their autoimmune symptoms worsened when they started taking LDN. Is this a cure for Hashimoto's? Low-dose naltrexone is a promising treatment option for people living with autoimmune diseases, including Hashimoto's. Many people with Hashimoto's have discovered that LDN improves their symptoms, including fatigue, lethargy, aches, and pains. But, research is lacking to support using LDN in people who have Hashimoto's. LDN is not a remedy for Hashimoto's. There is no cure to Hashimoto's. However, there are effective treatment options for managing this illness. Hashimoto's that triggers hypothyroidism could be treated with proper thyroid hormone replacement medication and lifestyle and diet changes. If you're enthusiastic about using LDN, speak to your physician about deploying it in addition to your thyroid medications. While scientific research is still required to study the way LDN can help people with Hashimoto's, evidence and personal success stories seem promising in treating autoimmune ailments.